Thank you, Victor. I'd like to ask both Victor and Diane to come to the microphone. This is a time for us to receive questions from the audience and to perhaps explore a bit more on the intake. I believe the microphones work one at a time, so if when you're asked a question you press speak, you'll be able to hear it. And we'll start with Dr. Goldman.
Hi, Lynn Goldman, George Washington University. I have a couple of questions for, I think, both speakers. But actually, it was the first speaker that showed some data about milligrams per kilogram of body weight. And of course, over time, the U.S. population is becoming heavier. And that's been a very remarkable trend. And I was wondering what the implications of that might be in terms of the fact that as far as I know, caffeine isn't distributed into body fat, and whether that's an issue in terms of looking at dosage, and if there, and maybe this is not something that you've thought about, but you may have thought about that, you know, what the most appropriate metric would be for the FDA to use for looking at body size, milligrams per body size. The other question that I had for both of you is the fact that, of course, FDA does use the 90th percentile as a high end, and at the same time, we know that there are significant, we're talking about exposures to the entire U.S. population, so, you know, there's significant numbers of people who are at the 90th percentile of exposure and above, millions and millions of people, and potentially millions and millions at 95th percentile, and even, you know, at the 99th percentile, there are quite a number of people. And whether the data that you've been able to evaluate allow the ability to look at even heavier consumers, or if you are aware of data that are available to the FDA to address the issue of very heavy consumers in the population, which I believe the NHANES probably is not big enough, for example, to be able to do. So those are my questions.
I really can't answer the first one. I think that you know, definitely the heavier people are, the more, you know, the milligrams per kilogram isn't probably the best measure if what you're telling me is true, that it's not distributed in the same way in body fat as in lean body mass. I think one way around it, although I would leave that to the experts, is to get some measure of lean body mass, but I'm not sure we can answer that with our data, so in any reasonable way.
You want to comment on 90th, 99th?
Just to say that we haven't looked at that, but we would like to look at that, address issues of those people that are in the highest consumption level, whether it's between the 90th, you know, above the 90th percentile or 95th percentile or whatever. But that is something that we have thought about, but we haven't yet addressed. Oops.
Just to comment on the body weight issue, because we run into that same problem when we do protein recommendations. And one solution that we had to use for that was to actually drive everybody's body weight back to ideal weight. So you drive everybody back to 24.9 BMI. And using the height. As long as you have height, you do have to have height, of course. But if you can do that, and then you can actually do it based on an ideal body weight. A comment on the 90th percentile. Actually, with the usual intake, depending on which age, gender group you're looking at, you can get to 95 and 99. We have to make sure that the standard errors are reasonable to report, but if your data slice is large enough with the number of observations, you can actually do that. So it's possible.
Can you identify yourself and then ask your question?
I'm Michael Jacobson with the Center for Science in the Public Interest. I think all these data are very interesting. I'm concerned, though, that kind of key facts have been buried under different kinds of averages. So consumption often you're combining for certain age groups, combining soft drinks in with energy drinks or coffee, and the soft drinks may account for the vast majority. And I would think the concern with energy drinks is acute exposure.
Excuse me, do you have a question? Because we're going to do the comments tomorrow
Yes, I'm coming to
afternoon.
my question, if you don't mind. For energy drinks, the issue is acute exposure. And I think it would be very interesting, and wonder if you have the data showing something like, for an age group, say teenagers, the number of exposures of caffeine from energy drinks or coffee, but looking at energy drinks since that's the topic du jour, how many exposures there are per year of teenagers getting X amount of say 200 milligrams or 150 milligrams or 400 milligrams or more. How many of those events are there per year? And how has that changed over the years as energy drink consumption has skyrocketed?
Diane, I'll let you start.
Again, I don't know that I can answer that. We did look at users within each beverage category. And if you're concerned about energy drinks, we don't have enough people consuming them to look at it that way. Now, we can look at acute exposure. We have 7 days of intake. We could look at caffeinated consuming occasions or events the way Victor has within a single beverage type. But I don't know that in our data set we can look at it for energy drinks.
My comment would be that, yes, you can do that analysis on consumption event per a single day. It all depends what you want to evaluate. The data are there, you could do that. I'm not sure how you turn that into a toxicological assessment, but that's for the others to decide. Now, it's the same concern Diane raised, is that, in these data sets, at least today, there's limited numbers depending on what age group you want to look at, particularly for, something like energy drinks. But I think you can do the analysis you're talking about.
Thank you.
Steve Lipschultz, University of Miami. Dr. Fulgoni, and your data, and hence, as you say, has strengths and limitations, where you're seeing statistically significant decreases in some of the younger ages. Is there any studies that have been done by you or others to do validation of, especially in children, the reporting, how that relates to true measured data? Because again, in the next series of talks where I'm chairing the session, some of the latest reports are that the highest poisonings are in the youngest ages. And if what you're saying is correct, then that means that the toxicity issue may be even greater than what's reported. But it depends on how accurate the self-reports by parents of their children in terms of consumption are.
Again, that is a limitation. The way Leanne Haynes does that, I believe it's at up to 6 years of age. It is parent or parental guiding person who provides the input, and after that, the 6-year-old can provide, but also parental data comes in, and then at 12, it becomes the individual alone. And I don't know of any data that actually has been done to actually validate that. I mean, there has been plenty of data to show in adults that we have some issues of underreporting, particularly in the overweight individuals, but I'm not aware of similar data in children.
If I could jump in for a second, I also think there may be some confusion because some of the energy, what we would call an energy drink, are actually a supplement and would be in a different part of the NHANES than has been reported today. So there is other data to consider.
Can I ask one follow-up question to Diane Mitchell in relation to Dr. Goldman's question, and that is, are you aware, because you brought up the issue of lean body mass might be preferable. I mean, we've seen this in cardiac toxicity related to certain cancer chemotherapy where they're poorly absorbed, and when we dose by total body surface area, it's incorrect. Are Are there preclinical studies that you're aware of to look at caffeine in terms of changes in body composition, in terms of target organ concentrations, such as heart and brain, which are the focus areas here?
I think we're going to talk about that in other sessions today. This is strictly exposure, so I don't think we can answer that question.
Dr. John Higgins from the University of Texas. My question is mainly to Diane, because Victor has already mentioned that the NHANES data does not look at a lot of the supplements which the energy beverages are categorized as. So, Diane, my question is this: the energy beverage marketing data from 2009 in the United States, if you look at the marketing and sales data on energy beverages in the United States, the amount of energy beverage consumed for every person, that includes babies, children, everyone in the United States, in 2009 was 2.5 gallons of energy beverage per person in the United States. Now, my question is that they are marketing very heavily to the teens through 35 years of age. And I'm just wondering, who's drinking, because I know babies are not drinking them, who's drinking, if we on average are consuming 2.5 gallons of energy, that's the sales and marketing data for 2009, who is drinking them, and is it possible the data is not capturing all of these events? Because it seemed to me that your data, I was expecting more energy beverage consumption, and I'm wondering who's drinking it?
I can't really answer that. I don't know. Just to say that we found very low consumption. I think the same limitations with self-reported data come into play here, as Victor had mentioned. And you know, there may be segments of the population that are drinking more of those things than others, but we didn't really address that.
So it appears that your data does not reflect the sales and marketing, that is, the people who are buying it. So we must be missing something. Would you say that's a reasonable statement?
It's possible, yes.
Okay, thank you.
Let me just comment on that. 2.5 gallons means 320 ounces a year. So, that's less than an ounce a day. So depending how you work the math, that's what's wonderful about statistics and math. So it depends on how you look at that.
Oh, sure. And that was across every person. So
yeah,
obviously there are going to be some people who are going to be drinking
John, I'm not
more
going
than
to argue
that.
with you on that.
Yeah.
But it's just important that we put things into perspective. It's an ounce a day for the total population.
Sure.
So, it's something to just think about. Now, I need to comment on your other comment about energy drinks. Energy drinks, as I reported them, the Red Bulls, the Amps, the Monsters, are in the NHANES nutrient intake data. They're not in the supplement data, so they are in the data that you saw today. Now,
Okay.
what's not would be dietary supplements, clearly
Okay.
the shots or other things that would be somewhere else, and I think you're going to have data on that later.
Oh, okay. Oh, thank you very much.
I'm not going to take more than a second. Hi, Lynn Goldman again. The person behind me is going to comment about the supplements, but I mean, I have a comment also. The NHANES, it is important to understand that the dates of publication are usually a couple of years after the dates of data collection, so there could also be a difference in time period between the marketing data and the NHANES data. The NHANES data always are a few years behind in terms of data collection. Data analysis takes time.
If I have my numbers right, when we did the 2001-2010 look at energy drinks as were defined on my method slide, we had a 229 subjects, which represented 2.5 million Americans. So that's the kind of
The
data
small
we have.
number, yeah, it's a small number of people to represent 2.5 million people. But
Agreed. But then
it's representative.
That's how sampling is done.
That's how it's done. So the other point, though, that I wanted to raise is at the beginning, Dr. Hamburg talked about some of the newer products that are coming forth that are actually food products that are now being crafted, or candies that are being, marshmallows, various things. I can't remember all the things she mentioned. But within the NHANES data, would those kinds of products in the future be identifiable is the question that I have, as caffeine containing.
Well, I guess, Lynn, I was going to go at it a different way from a standpoint. Since those products are not in the NHANES data set, though the product forms definitely are. A marshmallow is, and you could identify the age groups that most likely consume that marshmallow, that jelly bean, that whatever product you're talking about, and you could model those intakes. That's something that can be done.
I would add to that and say that it also gives you the opportunity to look at substitutions and to do category analysis by analysis. I think we haven't focused very much time today on usual intake, but the NHANES has extensive data on a number of these beverages where they've asked people over the last 30 days, how often do you consume? So there's a lot more information that can be gleaned to answer some of these questions. But I think we've gone a long ways with these two types of data to talk about this, you know, from panel data to the NHANES type of 24-hour recall to look at. We have one more question at the microphone.
Hi, Reagan Bailey from the Office of Dietary Supplements at NIH. I was invited to give a talk in this session about caffeine-containing supplements, but when I dug into the data, there were only 17 people in NHANES 2007 through 2010 that reported such a dietary supplement. So there wasn't much to talk about. The average range was 40 to 400 milligrams, but very low usage. So just wanted to make that point.
Thank you very much.
My name is Dr. Helen Okech. I'm from the United States Pharmacopoeia. And I have a question regarding exposure. The data you have presented here today is mainly about food and doesn't include dietary supplement. And maybe I'm preempting things, but I wonder whether you have considered that the possibility that dietary supplements such as sports nutrition could skew the intake of caffeine, because a lot of these products usually have a lot of caffeine, either from added caffeine or from other plant materials.
I guess I'll have to go back to what Dr. Bailey just said, that there's very little consumption of dietary supplement use and there's very little. I was thinking about possibly high-protein beverages or something of that sort that sports people might also use. That would be in the data set, but very few of them have added caffeine. So not sure how to really respond to your question.
Thank you, but I was actually looking at this specifically for the population that is more interested in gym and sports. As we know, there are a number of people. So for specific populations, not necessarily the whole population.
Yeah, thank you for that, because actually Dr. Higgins and I were over breakfast, we're talking about some other analyses that might be of interest, and that is you have measures of physical activity, and in some of the data sets in NHANES you actually have activity meters, such that you could do analyses based on those kind of characteristics.
And I'll just add to that we were not really able to look at that in our data set. There were a number of additional questions asked that we didn't look at, but I'm not aware of any way that we could look at an analysis by, say, exercise or sports fitness, that kind of group.
We have a question from a webcast listener saying that Monster was classified as a supplement until very recently. Was consumption of Monster energy drink included in the data for the analyses presented this morning?
Yes.
I'm glad someone raised that question because I forgot to mention it. Actually, USDA put out a data update for the FNDDS, the Food Nutrition Database for Dietary Studies, because they had Monster wrong. And so these data that you saw today actually have Monster correct for the caffeine content. So Monster is also in the NHANES data set.
I made the observation when you were both speaking that Diane has changed the concentrations of caffeine in products over time. And I wonder, Victor, did you do the same thing, or are you using the same caffeine concentration by year?
Each data release from the NHANES, it actually has its own food and nutrition database for dietary studies, and that's updated as needed by USDA. So each one has, so 2001, 2002 has its own composition. And again, you could actually do an analysis of has composition of coffee, tea, these beverages changed by any characteristic you want, by gram, by calorie, et cetera, over time. But so each one is very specific.
And you used them that way rather than picking one to use?
Oh, correct. No, yeah. One of the things that I think is wonderful about the NHANES system is it's publicly available. It's all, any one of you could have done these analyses. Now, you have to learn the NCI method, and that's not the easiest thing to do for usual intakes, but it's all publicly available, and so the best thing to do is to take it as it's presented to you and analyze it that way. Otherwise, you've got to characterize your modeling that you might be doing. I love the fact that you all could repeat exactly what we just did.
Are there any other questions? Maybe I'll ask the hard question, which is, and we won't really know this till the end of tomorrow, but our job is to match exposure to the toxicological interests. And to the extent that there's this need for characterizing by different categories of food or by different age groups, are the data available to do that, or are there data that are needed?
I guess it's interesting because these analyses were done well before I think FDA was even thinking about this workshop. And it's like, wow, why did we take out pregnant and lactating women? That's going to be a vulnerable group. Why didn't we analyze them separately? The answer is we didn't, but you can. And so, and what's great about that is it's not self-reported pregnancy. It's actually, biologically shown pregnancy. So I think that there are ways to use those data differently than, say, the nutritionist in me would use, but I think it's perfectly viable to do that. Now, whether you can, and I think you can do that for children, the caveat being, we're dealing with self-reported intakes, but it's the best we have, and therefore, as long as you understand that, I think you can use those data that way, too.
And I guess I would just reiterate, we looked at, women of childbearing age, but it's not the same as looking at pregnancy. To our knowledge, I don't know that they have that data in the Kantar World Panel data set. We did check on that early on because in the previous survey it was analyzed, pregnant women were analyzed separately. I think certainly you could do oversampling in some of the other vulnerable subgroups, but NHANES nor the Kantar Panel World Beverage or Panel Beverage Consumption Survey is not, their purpose isn't to look at caffeine. So, if you did a study, you could theoretically target some of those groups.
The last question I have is to what extent you think you're seeing consumers, or can you look at consumers to see if they're consuming from more than one beverage category to get their caffeine, so that we're really seeing as new products come as substitution, or are we really seeing it's added on?
We did present data showing the percentage of users across categories, and they obviously add up to well over 100%, so that obviously people are consuming more than one caffeinated beverage. Most of them are. We didn't look at it separately in that we didn't pull out multiple users and then look at what beverages are they consuming and when are they consuming them. So we have 7 days of intake, so we have a really robust set of data to be able to answer some of those questions.
And Barbara, the comment I would make is, and again, I'm thinking about it for this presentation, NHANES, every consumption event has a military time, a self-reported meal occasion, and such that you could actually decide, are there multiple events in one 5-hour period, 2-hour period, hour period? Are there other concomitant consumptions of other beverages or foods that might interact with caffeine beverage consumption? All of that is doable because you have this robust database. Now, you do have to challenge yourself on, where you're getting, if you're going to do energy drinks, I agree with Diane, there may need to, and you're worried about children, there may need to be some oversampling in the future to get a really robust estimate. But it's worth, I mean, the data are there, so it makes sense to actually think about how to use them best for this purpose.
Go ahead, Steve. But you need to go to the microphone.
Diane, I was just wondering, in light of the questions that just came up, you excluded the outliers beyond 3rd and 97th percentile for body weight. If Lynn's question is important in terms of vulnerable populations, potentially, and what Barbara was saying, the charge of this group to see is there a relation between intake and toxicologic effects. If you compare the total population as an analysis versus the excluded population, do you see any difference in your data?
We didn't look at that, but I will tell you that we consulted with a lot of childhood obesity experts. We only excluded, this was only children's body weight data that were reported by parents. We didn't exclude anybody else based on body weight. And the only reason we did that is because they were really well beyond what was reasonable. So, and the 97th percentile, you're already morbidly obese. So, you know, these were, and I will say that it was more on the lower end that the exclusions occurred rather than the upper end. So, you know, so anyway, does that answer your question? Yeah.
No, because if the hypothesis that there might be certain vulnerable populations, you could argue either extreme. So my question was, is that data really captured in your database so that potentially if you wanted to go back, analyze the total population, compare it to just the refined population, could you do that? That was really my question. And have you done
Absolutely, we
that?
could, but it was, I think, you know, we're talking in a neighborhood of fewer than 100 exclusions, so, yeah. But yes, we could, but we could do that, yes. Yes.
Trying again to stay away from comments and in the question category, we see the same thing when we look at the food consumption data, and we struggle greatly with what to do with the outliers. This is a national survey. They go spend a lot of time with a lot of people, and when you look at it and you see someone consume 9 kilograms of steak, your question becomes, is that an outlier? Do I leave it in? Do I model? What do I do with it? So I guess I would ask both of you the same question is, if we're going to go beyond, up to the 90th percentile, I don't see it. But if you're going to go above that, how are we going to handle outliers, and what do you think is the best way to do that?
I think the suggestion of doing the analysis multiple ways is a very good one. And I think thinking that then need to understand your limitations associated with the tails, either side of those populations, and constantly remind yourself of the number of observations that are probably there. And that's the best I think we can do.
I agree with that, absolutely.
I think we've reached a natural conclusion, so unless there are other questions, we'll stop now. I'll turn it back to our chair.
Thank you very much for a great presentation. Thank you. And thank you, Barbara, for an excellent job in sharing that. We're now going to move forward into a session that'll be a discussion about safety signals and surveillance of populations. And Steve Lipschultz from University of Miami is going to moderate this session. He is Chief of Staff of the Holtz Children's Hospital, Executive Associate Dean for Child Health, and Professor and Chairman of Pediatrics at the University of Miami Miller School of Medicine, where he studies the efficacy, long-term side effects, and outcomes of pharmacological agents in children using cross-sectional approaches. Oh, wait. It's been pointed out to me that we have a break. I apologize, especially to people on the webcast who I've now completely confused. We have a break, and we come back at 10:50. My apologies.